Pressure injuries. Pressure injuries, also known as pressure ulcers or bed sores, are localized damage to the skin and underlying soft tissue from prolonged pressure, shear forces, or friction. They usually develop over bony prominences like the sacrum, heels, elbows, or hips. Stages of pressure injuries. Stage 1, intact skin with non-blanchable erythema. Stage 2, partial thickness loss of skin layers with exposed dermis. Stage 3, full thickness loss extending into subcutaneous tissues. Stage 4, damage into muscle, tendon, and bone. Unstageable, obscured full thickness skin tissue loss. Prevention. 1. Risk assessment using Braden scale. 2. Manage moisture with gentle cleansing, moisture barriers. 3. Optimize nutrition hydration. 4. Reposition immobile patients at least every 2 hours. 5. Use pressure redistribution surfaces and devices. Treatment. 1. Debridement if wound has eschar or necrotic tissue present. 2. Select appropriate wound dressing to maintain moist environment. 3. Address infection if present with antimicrobials, antibiotics. 4. Consider negative pressure wound therapy for some wounds. 5. Monitor for signs of progression or healing. Hypovolemia versus hypervolemia. Volume status refers to the amount of blood and fluids circulating in the body's cardiovascular system. Hypovolemia equals decreased volume. Causes: hemorrhage, vomiting, diarrhea, diuretics, burns. Signs and symptoms: tachycardia, hypotension, poor skin turgor, concentrated urine. Hypervolemia equals fluid volume excess. Causes: kidney failure, IV fluids overload, medications. Signs and symptoms: hypertension, edema, shortness of breath, pulmonary edema. Nurses assess patients for increased thirst, intake-output imbalance, edema, vital sign changes, or rising BNP levels. Treatment addresses underlying cause and may include: 1. Diuretics, fluid restriction for hypervolemia. 2. IV fluid boluses, blood products, vasopressors for hypovolemia. Scope of practice. A nurse's scope of practice encompasses the interventions, acts, and processes they are permitted to perform within legal and ethical boundaries of the nursing profession. The specific activities within their expertise evolve over time alongside legislative action, evidence-based research, emerging roles, and technology. Nursing roles are expanding in care coordination, transitional care, community nursing, telehealth, and prescribing medications and equipment like diabetic supplies, orthoses. Educational advancement is promoting nursing responsibilities with advanced practice registered nurses taking lead roles in healthcare teams. As expert patient advocates, educators, and leaders navigating multifaceted health issues, nurses are advancing healthcare worldwide, especially in areas with health provider shortages. They remain the most trusted profession committed to holistic patient well-being. The future of nursing. Major nursing organization leaders created recommendations to support the critical role of nursing in transforming future healthcare in America. These include: 1. Practice to the full extent of their education training. 2. Achieve higher levels of education with seamless academic progression. 3. Partner in collaborative healthcare teams. 4. Improve workforce data infrastructure for planning and policy. With over 3 million active U.S. RNs, nursing has the sheer numbers to lead innovations. Emerging specialties include genetics, informatics, holistic integrative care, mental health, and addiction counseling. Nurses excel in preventive care, chronic disease management, and community health improvement needed to bend the cost curve while improving population outcomes most efficiently. Their versatility, compassion, and adaptability equip the profession to address complex future medical challenges never yet imagined.